Hello, my name is Dr. Jim Doty, and I'm the host of the Into the Magic Shop podcast, where we explore the mysteries of the brain and the secrets of the heart. Hi, this is Dr. Jim Doty, host of the Into the Magic Shop podcast. My guest today is Dr. Jonathan Fisher, who is a Harvard-trained cardiologist, a mindfulness meditation teacher, and actually oversees well-being and resiliency at Novent.Health, an organization of over 33,000 healthcare workers. He came to the area of burnout from his own personal experience, and as a result of that, has spent many years now not only healing himself, but also helping others heal themselves. He co-founded the Ending Physician Burnout Global Community and hosted the world's first global summit on ending physician burnout. Most recently, he's just published a book called Just One Heart: How to Train Your Mind and Heal Your Heart. I know you'll enjoy our conversation today, and thank you so much for listening. Jonathan, what a joy to have you with me today on the Into the Magic Shop podcast. Obviously, you and I are friends, and we've worked together on a few projects, one of which was the physician well-being that we did. And you are an expert in, if you will, physician well-being. And really what I want to talk about is your new book that just launched, Just One Heart, A Cardiologist's Guide to Healing Health and Happiness. And in some ways, we're both in the same space, which is to offer training techniques to those who are suffering in the modern world. And maybe you can just give us an overview of what your book contains and sort of some of the key points, and then we can delve a little bit deeper into those.
Jim, it's so great to be with you. And I just need to say it each and every time that your book, Into the Magic Shop, changed the way that I view the world, the way that I view myself. It validated the self-compassion practices that I began working on. And my patients, thank you for it, because they haven't necessarily read it, but they saw the differences in me after learning from what you had to share. So I want to just say that loud and clear. Thank you, thank you, thank
Oh,
you.
well, that's very generous of you, and I appreciate that very much. So thank you.
Well, yeah, and so you were also an inspiration. So I happen to. This is the book right here, Into Just One Heart, and this is actually.
You're going to say Into the Magic Shop. You were about to say.
Okay. No, you know what? The magic carries on. The magic carries on. So I'm going to share with you something that no one else knows, Jim, about this book. So people are like, "Oh, that's a pretty heart. It's a flower. This is supposed to be a lotus flower." And you know the symbolism of the lotus flower.
Sure.
It grows in mud and it can emerge and open and flourish. And the whole idea of the book is that if we treat the heart not as this physical pump that's a dumb organ, but instead respect and honor that it's the essence of our humanity, we start to see some real flowering, some flourishing, even from the dirt that may be a troubled past or a difficulty or burnout or depression in my case, whatever it is. The book is about the 4 dimensions of the human heart that have emerged after speaking with you and 50 other mind-body experts in the world and thousands of patients over the last 25 years. The heart is not just a pump. That's my message. It's not. And it's also, when we speak about the heart of compassion and the heart of love, it's not a metaphor. It's not a metaphor. And so this is my effort to go into the science looking, well, is there any evidence that a compassionate heart is actually a healthy heart? And not only that, not just the heart of compassion, which is the social dimension, but the emotional dimension of our heart. What about a happy heart? A happy heart is a healthy heart, and we can go into that. And that's what part 2 is about, the science of that. And then lastly, the 4th dimension of the heart is the one that we in healthcare, and you know this, we don't talk about it. It's the spiritual dimension of the human heart. And I just love talking about these things. And I want our healthcare system to change so that when you go to see a cardiologist, it's not just, oh, here's a $1,000 nuclear stress test and here's some statin medicines for you. But instead, it's a deep and meaningful interaction with a healthcare provider that's rooted in love and rooted in basic practices that help steady the human heart so that it can open and that connection deepens. It's rewarding for all of us.
Well, no, and that's fascinating. And obviously, we're very much in a line on that. You did mention for a lotus to bloom or grow, it requires mud. And I think Thich Nhat Hanh has used that metaphor a lot. There cannot be a lotus without the mud, which on some level recognize the nature of our human existence in that there is suffering in the world, but it's how you respond to the suffering. But I think also, especially with your book, understanding though that a lot of our suffering actually, in some ways, is self-created because we don't understand enough. The other thing, and before we really get going on the book, though, because you mentioned something that I think is important, and you mentioned your own suffering. And I think that what a lot of people unfortunately do is they look at people like you or I, and they may not know our backstory, but they assume we've had these incredibly privileged backgrounds and that our lives have sort of been perfect. And even people, you don't have to be poor or you don't have to have what, everybody say, oh my God, you lived through that. A lot of people suffer. And maybe you can just share about your own background because in some ways you had to be in that mud for a period of time before the lotus developed and blossomed. And maybe you
Yeah.
could share with us your own experience with that.
Thank you, Jim, for opening that door to the heart. I have to say that there's something about the word suffering that right away I clam up a little bit. And I think it was because of the way that I was raised, that you don't complain. You don't talk about, what's hard for you. My mom and dad both grew up in the 20s in the Great Depression. And you didn't complain about what you didn't have. You just were grateful. And so as we have this conversation, I want to acknowledge that there are people who are listening who are saying, oh, stop talking about your suffering. Suck it up, Buttercup. And what I'm here to say is, like anything else, when we start to compare ourselves to others and compare our suffering to others, it's a losing game. And this is not a competition to see who's suffered more. It's really, for me, it's an acknowledgement that we are the same. We all have our different flavors and magnitudes, but it's not about I suffered so much. To answer your question in a very, very short version, I was wired on the big five scale of personality traits, the N and the ocean scale. The one, it's neurotic. So I was very high on the neuroticism scale, which also went along with rumination and anxiety. And eventually that, for whatever reason, probably because of a self-fulfilling cycle of I would isolate myself because I would always think that I didn't belong. I became depressed and alone. And I'm talking about high school and then college and then medical school. And then I even worked so hard to get into the hallowed halls of Harvard University. And I thought I was just faking it. And people would figure out that this is a loser, this guy. He's anxious, he's depressed. Jim, I was sneaking during my residency for the very first time. I was sneaking off to see a therapist. And I was hiding myself it's cold in Boston in the winter. And I would flip up the collar of my jacket, literally, so that nobody would accidentally see me going into a psychiatrist's office because I was so ashamed of even seeking help. And things got worse after that. So this is the beginning of my story. Things got worse. That's life, right? Life is suffering. It's rule number one, or there is. And for me, it was because there was one person who actually encouraged me to go see a therapist, even though it was not a cool thing in my family. I'm one of 7 children. We're all doctors like my dad. It's a long story. And in my family, it was all about putting on appearances of expertise, knowledge, and know-how, and also helping other people along the way. Like, it's good if you do that. But it was not okay to feel confused. It was not okay to be sad and to cry and to weep. And it was not okay to express anger and to yell. You had to put on this face. So the one person in my life who saw that there was a gap between my external persona as a doctor and my internal experience was my sister Andrea, who I loved her, and she's not with us today. It was 14 years ago. She was 40 years old, and she taught me the power of self-compassion, and she said, "Can you be kind to yourself?" And she started me on this path just before she called to say that she was having blurry vision, Jim. And this is in your alley. And my sister Andrea was a radiologist in New York, very talented radiologist. And her eye doctor said, "I think you should have a brain scan." And she read the scan herself, and it was a tumor the size of a golf ball sitting on her tectal plate, which for a year she went around the world and she tried to find a surgeon who would remove it for her. And no one in the world would touch it. And so Andrea, over the next 4 years, went through all the treatments, and I was with her, and I was grieving before she was gone, and I fell apart after she eventually died of a brain tumor, and that was the beginning of a path where something had to change for me.
Well, and again, it just emphasizes that all of us are suffering. I'm sure you've heard the story of the person who went to Buddha and their child had died, and she said basically, and I'm probably screwing this up on some level, but it says, please use your power to bring my child back. And he says to her, he says, I want you to go to every household in the village and ask them if they've suffered. And basically, of course, she goes everywhere, and everyone has a story of suffering or loss. And she comes back and she says something like, well, everybody's experienced this. Nobody offered to help or anything. And he said, do you understand? This is the nature of our lives, and you have to accept things. And I cannot bring your child back. And in some ways, it was a profound moment because she understood the nature of suffering, and all of us must go through suffering. But the thing is, though, that we don't have to always suffer. And again, it's how do you make the lotus blossom? Yeah. You were talking about the heart, and you're talking about the healthcare system, and I've what's the word? Is it pontificated or gone through my own anger narrative of the healthcare system? And you mentioned how doctors often don't care. And maybe you can give some of your own insights into the cause of that, because a lot of people say, well, I went to my doctor and he rushed me through, et cetera, et cetera. He was always on the computer. But maybe you can also note how having to go through that as a physician affects you, and this idea of moral injury.
Yeah. I can tell you my own experience, and then the fact that I started sharing my own experience with others very slowly and found out that I was not the only doctor who was going through this very predictable cycle, which is still happening today to our medical students. You start off with a sensitive kid, boy or a girl, teenager, who maybe experiences some loss in their life or watches a loved one get sick. Maybe they're good at science and they say, you know what? I want to serve the world by becoming a doctor. And we have these grand dreams and this big heart. So I go on and I work hard. And then you get into medical school. And day one, you go into your anatomy class, and they fillet open the human body with very little warning, very little honoring of the spiritual side of this life that was given over. Maybe there'll be a quick prayer. And then, let's say months later, you'll watch your first patient on the cancer ward die. And in my case, what often happens in the intensive care unit, things are so busy and you've got so many demands on you that after someone dies, there isn't a moment's pause to even say a prayer or a blessing or a thank you or an acknowledgement for this life that was lost. And it's on to the next, because we have another emergency. And so what's happening in that moment, there's a chipping away, an erosion of our natural, profound empathy, which I believe doctors have it. We have it in spades. But what happens is bit by bit, it's taken away. And then maybe we'll have a medical resident or a teacher who has gone through their own suffering and hasn't learned to regulate and to open their hearts again. So they treat you in a toxic, mean way. Well, I had it rough, so you're going to have it rough. And maybe they don't let you take a bathroom break when you need one. Maybe they keep you standing in the operating room for 10 hours without allowing you to scrub out. Maybe they try to make you feel stupid by what you don't know in the operating room by asking you questions. Now, all of these things may sound hypothetical, but they all happened to me.
Oh,
And this is not just me. And so what I want people to know is that the doctor that you're seeing today, this is not the person, the human being who went into this field. This is a person who's gone through the change, the insult. Some people call it the moral injury, which is a term you brought up, which originated in the 1970s in wartime. After Vietnam. It's soldiers in the battlefield are asked to do things that they never wanted to do. And sometimes it involves children and pregnant, and whatever it is. And there's a suffering that happens in the soldier. Well, that happens in healthcare when we're forced to take care of patients with COVID whose families aren't allowed to be with them when they're sick and dying. And it breaks our own hearts. Literally, it breaks our own hearts. That's moral injury in a nutshell, which is just one very small aspect of burnout, which is a very complex and fascinating problem that we've got to end. And you've been working on that as well.
well, and that is the thing. And maybe you could just, and I'm not trying to put you on the spot, but just tell us a little bit about some of the statistics that are affecting doctors in terms of leaving the profession or actually choosing different pathways. Because again, as you pointed out, when you have this belief in sort of the sacredness of medicine and the privilege you have, yet you're not able to be the person you want to be. And it is extraordinarily challenging. I can tell you for myself, uh, uh, we are supposed to see a certain number of patients, which I'm sure you have that same experience. And there's no consideration for the humanity of the patient, that every patient is different. And I actually just refuse to participate. I say, I only feel comfortable seeing this many patients. I will not see anybody else. If it takes me 2 hours to see a patient, I'll do it. Now, I was in a slightly different circumstance in that obviously everybody has to live, everybody has to have a job, everybody has to get paid. But I just said, I'm just not going to do it. And I would live the way I would have to live on that amount of money. And I was probably the lowest paid neurosurgeon. And, the other problem, of course, is that a lot of our patients, I would be their second opinion, and they had been scheduled for surgery or told they needed surgery, and they did not need surgery whatsoever. So people are motivated, actually, unfortunately, to make money because it's a system that has an upside down reward aspect where I only get paid if I operate. Well, geez, shockingly, more people operate. And, but yeah, that's unfortunately the way it is for so many of us.
Yeah. Jim, you asked about statistics, and people ask me, why are you in this work of ending burnout? It's a loser's game. There's no ending it. It's a game over. We have a broken system, and some of it is selfish. We're going to be short in this country by 2030. At least 100,000 doctors, which is why there's this struggle to get artificial intelligence to become your doctor and get a nurse practitioner to become your doctor, et cetera, et cetera, et cetera. And right now, the rate of burnout, which is either a deep cynicism, depersonalization, you know it. When you've gone to a doctor and they're burned out, they're physically exhausted, emotionally exhausted. Their hand is on the door. They're looking at their watch. All of these telltale signs that every patient has seen. And we're like, what's going on here? Well, the trend is escalating. and it's devastating consequences. We're short about 100,000 doctors just 10 years from now. Right now, more than half of all doctors are burned out to some degree. And this is an important piece. It's not just burnout. Depression, clinical and subclinical depression, affects at least 10 to 15% of those doctors who are burned out. So people are saying, oh, let's just fix burnout. We'll get rid of it, make it a better workplace. That's still going to leave us with the residue of tens of thousands of healers who need mental and emotional health care themselves. And in order to do that, we have to get them, like me, in the door of the therapist's office because they're afraid, because we've perpetuated a culture, not just in healthcare, but in our society, where it's not okay to say, I'm on a medicine for depression. I seek therapy for depression. Because the fact that I can say that to you now, Jim, this is baby steps. I've been slowly taking little risks along the way over the last 10 years because, as Brené Brown says, part of the healing process is sharing what you are ashamed of, sharing shame, and not dumping it out. And so one of my goals for speaking with you today is, whether it's a doctor or a nurse listening or a therapist or a social worker, in order for us to really heal and set an example for our patients, we have to be willing to share some parts of ourselves that aren't so pretty, that are the broken parts, and to say that that's what makes us human. That's what connects us.
Well, it's funny you say the broken parts. I'm sure you're familiar with the concept of kintsugi, where this is the repair of broken pottery, which occurred around the 15th or 16th century, by mending the pottery with golden glue.
Mm.
And the metaphor, of course, for this is that it doesn't appear as though it's not been broken. In many ways, that brokenness honors the person. There's nothing to be ashamed of. It shows what you've been through. It shows how you've overcome it. It shows how you've repaired yourself, how you've come together. And there is no need to hide that. In fact, there's some honor in accepting that you've been able to overcome. And I think this destigmatization, because as you point out, unfortunately, there's this narrative that continues to be perpetuated that somehow doctors are above this, and if they show weakness, then they shouldn't be doctors, or that's an embarrassment. And this artificial narrative that somehow doctors are perfect or immune to suffering has only exacerbated the problem.
It's so true, Jim. And when you were describing the kintsugi, I think that you were the first person to share that metaphor with me, and it gave me such hope because I really changed the way that I think about us as humans. And the title of my book is A Cardiologist's Guide to Healing, Health, and Happiness. And when I think about kintsugi, it comes to healing. It's about, what is healing? And what I believe now is that healing begins in the mind. It begins by shifting our view of ourselves as even broken at all. There is no broken. There's just human. And there's actually a beauty in frailty. There's a beauty in vulnerability. There's a beauty when you become emotional, and I can see it on your face, and I start to get choked up too because of, yeah, I do. Thanks a lot. I didn't count on that today. That should teach me a lesson. But for me, the word is the key. And John Kabat-Zinn talks about this, that the root of the word health and healing is wholeness. And that's what that broken vase of kintsugi with the gold cracks filled in. We are not broken. We are already whole. And once I can get my patients to see that, whether or not they've had a massive heart attack, whether their heart is weak and failing, they tend to fall apart. They tend to fall apart because they're afraid that tomorrow may never come. They're not going to get to say goodbye to their children. They're going to leave, everything in shambles. And part of the work that we do is to help them see that they are not broken. They are a spirit whose physical heart may be wounded, but there's so much more to the heart than that.
Well, you use this quote from Aristotle: educating the mind without educating the heart is no education at all. And I think that's very important for physicians, but I think it's also to let others understand that. And maybe you can talk about the brain heart connection for us and what that actually means in some ways, both metaphorically as well as, in fact, in reality.
Well, Jim, there's been three different audiences that I've been terrified to speak in front of, okay, about the mind-heart connection. The first one was my colleagues. I had to speak in front of 75 cardiac surgeons and cardiologists about the mind, body, and spirit, and I thought there was going to be tomatoes thrown at me. So that's the first one. The second audience was a month ago. It was statewide employee assistance program professionals. These are psychotherapists, and I'm talking about the mind-heart connection. And now the third audience is you, a neurosurgeon who talks about the secrets of the heart. Who am I to tell you anything that you don't already know? But since you asked, it's really, I'm hopeful that together we can have people understand in a very simple way that there is no separating the mind and the heart. There's a brain here, yeah, but the brain is not the mind. The mind is much bigger than the brain. The mind is my body. It's my heart. It's our connection. That's part of what's I call my mind. There's really simply, Jim, there's three ways that the mind and the heart are connected. And if we want to strengthen that connection, we have to be aware of all three. The first is the mind itself. So activities in the mind, an emotion happens, a pain happens, and there's a cascade. The sympathetic nervous system, the cortisol or steroid system gets activated or deactivated, and the vagus nerve calms it down. So that's the mind. And then that cascade of neurochemical information floods the body in an instant. And there are changes now in part two in the body. And whether you're talking about the lungs, the respiratory rate increases, the eyes, the pupil can dilate or constrict. I particularly focus on the heart in the book, and I describe how there's constriction of the delicate blood vessels of the heart, so much so that in cases of profound stress or grief or loss, or even the death of a loved one, you're at a 20% increased risk of having a heart attack yourself because of this mind-heart connection. And there's also a thickening of the blood, which puts us at risk for heart attacks and strokes in these situations. And there's also an increase in chemicals that cause irregular heart rhythms. So you can develop what's called atrial fibrillation, ventricular tachycardia, premature ventricular complexes, and the list goes on and on and on. So now we have this communication beginning in the mind, moving into the body. And as if that weren't enough, we have this whole thing called behavior to account for. And that's really the third, as I like to see it, there's the third link in this mind-body chain. And behavior is something that the world can see and that we can see when we look in the mirror. It's why we either make healthy choices or unhealthy choices. It's what accounts for more than 70% of all wasted medical care in the world today. It's behavior that could have been shifted towards a more healthy choices if we had looked at some of the root causes of disease rather than just patching it over. So the three connections between the mind and the heart are the brain, the body, and our behavior.
Well, actually, let me just talk about that a little bit because, as you well know, behavior change is one of the hardest things there is. And it is very difficult. And unfortunately, for many people, probably on some level, including myself, a disaster has to happen before you take it seriously. And that being said, and you've been talking about engagement of the sympathetic nervous system and the flight, fight, or fear response, which can be very deleterious, as you well know. Of course, the system has been with our species and many other mammalian species for millions of years, and it's to protect us from threat. But unfortunately, in the modern world, it is chronically activated for a lot of people, and of course, it has very negative consequences. Mm. And you mentioned John Kabat-Zinn. So, on some level, and maybe you can talk about this from your own experience, how do you shift from this fear mode to, and I would tell you, I would call it the love mode. How do you shift from your view of the world as a place to be afraid of or fearful of, to seeing the world through a different lens of openness, generosity, kindness, and love.
Hmm.
And this is engagement of the parasympathetic system, or our rest and digest system.
Yeah.
Tell me some of your own techniques, or how these different techniques to actually train your mind in a different way, or to reclaim your self agency, to actually have a positive effect, not only on your mental state, but your body.
Hmm. Jim, that's the question that leads into the heart of the book, and you're sort of giving away the punchline of the book. I heard you're not supposed to do that,
Oh,
but
sorry.
no,
I'm
no,
trying
no.
to move you along here.
I'm joking. I'm
No,
joking.
I know. I know.
So chapter 12 of the book, and it's not designed as a teaser, but I really realized that it's not so easy. Yeah, we can do a breath practice or two. We can practice self-compassion for a minute. We can go for a walk outside. That's a quick solution. For me, that wasn't enough. I needed a broad blueprint for how to work with this tricky mind, as Paul Gilbert calls it. To work, it's a stepwise process. And it ends with what you asked about. Chapter 12 of the book is called Warmth: How to Love with a Warm Heart When Life is Cold. And so everything up until that point, beginning with the first step, if someone comes to me and they're having an irregular rapid heart rhythm and they're totally chaotic and unstable, I'm not going to start with a self-compassion practice in that moment. I'm not going to start with practicing empathy in that moment. So there's a first step and there's a last step, I believe. And the first step is steadying ourselves. Like you said, life is so chaotic. So we need to understand what stress is and what stress isn't. Stress is not a challenging experience. Stress is not feeling concerned about something. We're calling everything stress and anxiety now as if it's a horrible thing. So we learn about what stress is, and we first steady ourselves using the body. Um, in my personal experience, most of the stress I've experienced happens up here. And then there are changes in my body. So I begin by working in my body, whether it's taking a specific type of a breath, which is a diaphragmatic breath that activates that vagus nerve you were talking about. Stephen Porges, who I interviewed for the book, describes exactly how the two branches of the vagus nerve help cause this response of the nervous system. And so a few nice diaphragmatic breaths are a good place to start. And then grounding ourselves, whether it's my feet on the ground, bringing some sense of safety. I think a lot of what is keeping me up at night and why I woke up at 4 a.m. last night, and I shouldn't tell you this because I'm the heart doctor who's supposed to live really healthy. I'm not sleeping well. There's just so much going on in the world right now. And I want to be honest about that again. So I have to do the same practices that I'm sharing with others. And it begins with a deep breath. And then it begins with a checking in with my body in a non-judgmental way. I don't say, "Oh, I can't sleep. I'm horrible. I'm hypocritical." Instead, I say, "Oh, it's like this right now. I'm having trouble sleeping. Isn't that funny?" Again, right? This is life.
Yes.
So I try to bring along with that. I try to bring some acceptance, and then beyond acceptance, then I amp it up and I go into your territory. I bring compassion to myself. Whatever suffering I'm having, however hard life seems, what always makes it better is loving myself in that moment as if I were the mother that maybe I never had. Maybe it's putting a hand on my heart and saying, "Oh, life is so hard now, dear. We're going to make it through this. I've got my own back." And so for me, Jim, very simply, it comes into using the breath and the body, basic mindfulness practice, and really self-compassion. And once I do that, that empathy that we talked about before that gets chipped away from our life experiences, we can start to discover that for ourselves. And and I know you believe this. I've seen the research. That empathy starts to emanate naturally. It's our birthright. We're all born with that. It's that it gets covered over and eroded. That starts to emerge again, and then we can stoke that fire, the fire of empathy instead of the fire of anger, with lots of other practices like loving kindness and compassion practices.
Well, it's interesting. You talked about kintsugi, and which I obviously, apparently, you heard from me. But uh, but there is a phrase which you use, which I think is important, and that is that what people don't appreciate is that all of us are frail, fragile human beings who are trying to survive in a challenging world, and we beat ourselves up.
Mm,
And you alluded to this that, and I would use the terminology, we are perfectly imperfect,
mm,
and that's okay. And accepting yourself in this type of a situation is very hard for people because, again, especially for physicians, you don't want to sit there and say, I'm a frail, fragile
mm,
human being and I suffer. And
mm,
I think accepting that as the nature of our humanness, that is what
mm,
makes us human. But more importantly, I think also is to understand that everyone is suffering. And in some ways, that recognition, I think, can be very helpful
mm,
because so often we feel like we suffer alone.
mm,
And I think acknowledging that everyone is suffering on some level and not being as hypercritical oftentimes as we are to ourselves,
mm.
to other people. And
Yeah.
when you learn these types of practices to offer yourself self affirmation or to love yourself, this actually changes how you see the world.
Mm,
And I think also understanding, though, and I think you also said this, was that we have immense power in our brains and we can actually train or learn these types
mm,
of practices to help ourselves. And I think that's very, very powerful for
mm,
individuals.
mm. Jim, as you were describing that, it occurred to me that there's a reason why, when we're feeling this way, we tend to think we're alone. And it's not just because if you go to Instagram, everybody looks beautiful and happy and pretty. And that's a huge part of the problem. Jonathan Haidt just came out with a beautiful book called Anxious Generation about that. And there are these echo chambers that in our culture make us all feel like we're alone in this internalized experience. But the other is just part of our evolutionary biology that when we're under threat, our vision narrows. When we're under threat, our heart quickens. When we're under threat, our attention, our ability to see the future, to predict what's around the corner, to consider other people's point of view, mental models, it diminishes. It's just part of how we're wired because that may not serve us in the moment. So for me, the challenge is to do something that's a little radical and to go against what we are wired to do, which is we're wired to turn inward and to think we're the only one, but instead to expand our consciousness. And the Stoics taught this, and the Buddha taught this, and any wisdom tradition teaches this, that on a daily practice, every morning, remember that we are just one of all of humanity and we're all connected. Even in my moments of suffering, can I remember that I'm not alone in this? And it's a beautiful, it's a Buddhist practice. I'm not alone in this. It's not just me. And then to say to you, just like me, Jim Doty has suffered in his own way. Just like me, Jim Doty has his own dreams and wishes. And so for me, that practice when I'm with my patients and my colleagues, it really helps me remember that connection you're talking about.
I think the other thing that people don't realize is that while we are naturally wired, as you described, we do have the ability to change how we respond. And when we
Mm,
change how we respond and change our perception, that I think changes everything.
mm,
I'm sure you're familiar with Viktor Frankl
mm.
and the quote that's attributed to him. I say attributed to him because no one has been able to actually find it other than in the writings of Wayne Dyer. But it's between stimulus and response, there's a pause, and within that pause lies your freedom.
Mm,
But I think that is important to understand how you respond, and it's a choice. And when you're able to take a bit of time, then instead of having that narrow focus, you're able not to go there. And it makes your decision making much more discerning, I think.
Yeah, absolutely. Jim, I wrote this book for myself because I didn't get this education. I mean, my dad is an incredible role model. Bless him. He's going to be 98 years old. He was the town doctor for a little town in New Jersey. I just saw him a week ago, doing great. My mom
Is he
was
still practicing?
No.
But I read about a doctor who's 102 and still practicing.
That would be called malpracticing.
Who are you to judge?
No, you're right. So actually, that's my dad's old doctor's bag back there, the leather bag.
Oh, wow.
He would do house calls back in the day. Yeah. So, oh gosh, where were we even talking about?
Emotion regulation, sort of.
Yeah.
And
I was
changing
saying
your perception.
Yeah, perception. And then, you were talking about, that making a choice. And for me, there's something that we also don't talk about in healthcare a lot is what does it mean to make wise choices? And so I decided to research, of all things, wisdom, because people like you and people I consider heart-centered leaders, there's a wisdom there, and it's a wisdom of the heart. You talk about the mysteries of the brain and the secrets of the heart. I love that. And so I was like, okay, I want to figure out the secrets of the heart too. I'm a heart doctor after all. And so for me, the heart has a wisdom that's profound. And so there's a whole section on what does it mean to listen to and acknowledge the wisdom of the heart and not poo-poo it as some weird mystical mumbo jumbo stuff. There's actually plenty of evidence that shows that people who pause to ask themselves a question and listen for what emerges from the space around the heart make better decisions. They think of others. They have a broader perspective on themselves, on their life, and on the world. And so I love that you brought up that kind of consciousness aspect of it.
Well, Jonathan, obviously we never have enough time, but I would recommend to anyone that they buy your book. And there is a great amount of wisdom within that book, Just One Heart. And I think, obviously, this can be of great benefit to physicians, but it can be just as great of a benefit to anyone. And the wisdom that you provide in that book, the filtering it to make it more accessible, I think really is an important part of this book. And I think, and I know already it's been very, very well received. And again, I would just like to suggest to any of the listeners that they buy your book. And as always, it's great to hang out with you a little bit. It's a joy and a pleasure. And I do hope that we actually have an opportunity to meet in person. I'm actually going to be out in New York at the end of May. So maybe we can have... are you in North Carolina? I keep thinking, yeah. I'm not getting to North Carolina for a while.
I am part-time in New York, but if it's not in New York, Jim, I can see it happening. We're going to be together soon.
Okay, my friend. Well, much love to you, and thank
Likewise.
you for giving this gift to the world. And I'm so appreciative of you being with me today. So thank you.
Thank you so much, Jim.
Again, thank you for being with us today. The Into the Magic Shop podcast can be found where you find your most popular podcasts, or you can find us at intothemagicshop.com.